Hello, my name is Barbara Dilly. I will briefly introduce you to the program faculty members. We are broadly trained in both qualitative and quantitative research methods. Our areas of expertise range from domestic to international, from examining behavior at the level of individuals, families, and communities, to understanding how healthcare systems, corporate structures, and national policies and programs affect health and well-being. We are all mission-driven in defining our research agendas and have an applied dimension to our work. We are men and women with and for others. I received my PhD in Comparative Cultures and Social Science from the University of California at Irvine. My mixed method applied research focuses on understanding the sustainable social and cultural institutions of rural American communities and their adaptive capacities to address local issues. I'm currently examining the range of healthcare needs that rural communities can address through locally specific social networks of extended family and neighborhoods assisted by cultural institutions such as churches and community clinics and hospitals. Father Ray Bucko's Society of Jesus received his PhD in anthropology from the University of Chicago. He has worked extensively with Native American communities to understand Native ways of health, illness, and healing. He has worked collaboratively with Native American nurses to understand the significance of social relations embedded in Native American caregiving. His research also places these cultural dynamics within the context of the political and economic inequalities that plague Native American access to health and well-being. Dr. Helen Chappell received her PhD in medical anthropology from the University of Virginia, where she also earned an MA in clinical ethics. She has an undergraduate degree in nursing and teaches ethics to senior nursing students. She has extensive experiences as a hospice worker, which informs her retrospective research regarding how dying occurs in the American hospital. She continues to explore the phenomenon of dying patients in the hospital as an underserved population. Her research interests also include the anthropology of reimbursement mechanisms. Dr. Laura Heinemann received her joint PhD in anthropology and social work from the University of Michigan. Her research on the social and cultural relations of organ transplantation in the United States is groundbreaking in the examining of effects of biotechnology-driven healthcare. She is currently developing her applied focus on evaluating and enhancing healthcare delivery among diverse populations at Creighton's clinics in Omaha. Dr. Rebecca Murray received her PhD from the University of Nebraska Omaha School of Criminology. She is widely recognized in her field for her specialization in quantitative analysis, utilizing a variety of data manipulations. She has worked with limited dependent variables, collapsed independent variables, and lagged variables. She is proficient in working with a variety of software programs including SPSS, SAS, MATLAB, and Stata, as well as working with quantitative spatial data and GIS programs such as ArcGIS and MapInfo. Dr. Alex Rodlick, Society of the Divine Word, received his PhD in anthropology from the University of Florida, where he researched explanatory models of the AIDS epidemic in southern Africa, particularly Zimbabwe. He continues with this research, exploring how these models affect access to healthcare services in that country. He has also developed research relationships with the Mayan community in Omaha, and together with others does a health needs assessment of that community. In Omaha, he is part of a research project that explores refugee health at a local clinic with the aim to improve health services for refugee populations. Dr. Diane Travers Gustafson received her PhD in Human Services from the University of Nebraska-Lincoln, where she focused on medical anthropology and public health with a specialization in gerontology. She also has an MS in nursing from Creighton University. She has participated in 2 NIH studies promoting rural health. She is currently investigating the effectiveness of vitamin D supplementation to prevent cancer in older rural women. She also investigates the health needs and concerns of refugee communities in the Omaha area.